Hi guys, Adam here from Care for Health, and in this video I'm going to be briefly talking about the rotator cuff muscles and how they can give you pain and discomfort in the shoulder. So basically there's four rotator cuff muscles. You've got the infraspinatus, the supraspinatus, the teres minor and the subscapularis. And all these muscles attach from the shoulder blade and they come across and attach onto the top of the arm, and they provide movement. So go taking the arm out, taking the arm in, and even bringing the arm out to the side like this. That's just one of the things they do. Another thing they do is they work to stabilise the ball and socket joint, so that the shoulder keeps nice and stable and sturdy in that position when you're doing things. With rotator cuff pain, it can either be from an acute episode, for example, playing rugby and landing on an outstretched arm. This can obviously strain some of the muscles. Or secondly, it can be from an overuse type of movement, so for example, repetitive throwing, like that. So if you injure the muscles acutely, like any other muscle, if you were to stretch the muscle hard enough, you're going to tear the fibres. And these tears will lead to initially inflammation, which leads to pain, and then everything. So the fibres aren't nice and knitted together, they go a bit of a mesh. So they need to be rehabilitated to get back to their normal position. If you have rotator cuff pain from more of a long-term overuse injury, where the rotator cuff muscles sit, they sit a lot underneath a bone in a joint space. So for example, if you're repetitively lifting your arm up in a faulty position, that's going to be constantly compressing the tendon where it sits underneath the bone. And over time, this repetitive friction can lead to a thickening of the tendon, which, if you can imagine, means that it won't move as nice and smoothly. So one of the first jobs as a practitioner trying to identify this is trying to find out exactly what rotator cuff is involved, and then give you the appropriate rehabilitation to get it better. So initially what we want to try and do is calm the area down. So this a lot of time will be with using ice and just range of motion exercises. Then we'll start to give you some specific strengthening exercises to get that tendon working more efficiently back to its full strength. And this can all depend on what you want to get back doing. So if you're a cricket player, for example, we'll give you more specific exercises for throwing in cricket. Or if you're just gardening, again, it'll be totally different exercises to try and get you back to gardening pain-free. So if you or someone you know is suffering with any shoulder pain, please don't hesitate to give us a shout, and then we can help you on the road to recovery. Thank you.